Studies have shown that artificial intelligence is getting better at diagnosing patients. So, can artificial intelligence replace your family doctor? Artificial intelligence is becoming more common in the medical world, but in my opinion, there are three main issues with this. First up, examination. Who can replace a doctor's examination? For example, a doctor might want to have a listen to your chest, they may need to look in your mouth, they may need to look in your ear, and simply at the moment, AI cannot do this, unless of course robots take over. Secondly is hallucinations. We all know that AI likes to hallucinate. That means it likes to make things up. So you might present it with a bunch of symptoms and it might just make stuff up at the end of it, which isn't very accurate. And thirdly, and probably most arguably the most important aspect of this whole situation, is privacy. Yes, it can be really fun putting in some symptoms into ChatGPT and working out what's going on with you, anonymously of course, but do you really want your personal patient-doctor conversations being uploaded onto the cloud and who knows what's happening to that information? I know I don't. So today I'm testing out an application called Diagnosis Pad, which works offline. That means there is no internet connectivity. The artificial intelligence is exactly in the device itself. So just to show you guys that I'm using offline, there's no Wi-Fi connectivity and there's no cellular network. Now, I've been a doctor for over a decade now. I'm going to push this application to its limits. I'm going to present it with some simple cases, some interesting cases, and some quite hard cases, and we're going to test it out and see exactly how it fares. So for this test, I'm going to present it with 3 different case presentations, and I'm going to let you guys know what the diagnosis is before I present it to the AI. That way we can both be on par with working out what it's going to say. Now, for this to work successfully, I'm going to be doing the patient and the doctor conversation myself. I'm not going to be giving too much away to the AI, but I'm going to be doing it in a reasonable way that my patients would normally present to me in practice. Let's get going. The first diagnosis is going to be tonsillitis, or a throat infection. Hello, doctor. Hello, how can I help today? Oh, doctor, it's my throat. It's been hurting me for like a day or so now. Okay, so it's been hurting you for a day or so. Can you describe to me what it feels like? Oh, it feels like I'm swallowing blades. It's so uncomfortable. I see. And with that, do you feel hot at all? Do you have a fever? Well, yeah, actually, I did feel like I was shivering last night, and I think I was really hot and sweaty at the same time, so I didn't feel too well. Okay, and so you've got a fever, and also you said it's hurting when you swallow, but what about any cough, any other symptoms at all? Well, no, not really. I haven't been coughing, and I don't really have any other symptoms. It just really hurts. My throat is really, really sore. And do you feel that it's getting better, for example, if you're taking any painkillers? Well, I did try to take some painkillers from over the counter, and it kind of did help, but it still really hurts me. I see. And have you had this before in the past? Yeah, I had it about maybe a year ago now. And yeah, I can't remember what the doctor said was wrong with me, but yeah, I think maybe you could help me. Yes, of course. Let's take a look inside your mouth. Okay. Let's pause the session. So I've tried to be as vague as I possibly could as a patient, because often you do get presented that in general practice. And let's take a look. So now it's processing, it's thinking about what it wants to do. This is doing it all in real time as well. So it's not having to send it to the cloud. It's not processing it anywhere. It's doing it in real time as we were talking. And you might have noticed that as we were talking, it was changing a couple of diagnoses. It was writing down the transcription. So it's taking a listen to my conversation with my patient, and at the same time, it was also providing me with a bunch of notes as well, that as a doctor, I can use these notes and put them onto the patient's file, which actually is kind of cool. So let's take a look. So over here, we can see that it says possibly the #1 diagnosis is acute pharyngitis with possible viral infection. So that's pretty good. I mean, certainly it is hard, I have to say, without examining a patient to work out if they have got a viral infection or if they've got a bacterial infection. And really the only way that you can have a look at whether someone's got tonsillitis is by having a look at the back of their throat. So potentially I could then say to this AI, or I could say to my patient, we could mock up an examination and say, yes, I can see inside your throat there are some white spots. So I might just do that and see if it changes the diagnosis. Okay, so let's take a look inside your throat. Say, ah for me, ah. Yes, I can see that your tonsils are really quite enlarged, and there's actually some white spots on the back of your throat. Okay, so now we're going to pause it right there, and we're going to see what changes with the diagnosis. So it's pretty quick in terms of changing its recommendations. Let's take a look and see once it's loaded up. Now that we've given that little extra nugget of information, has it now gone from a viral infection to a bacterial, or will it just stay as a viral infection? Let's find out. Okay, so first diagnosis says suspected tonsillitis. That's pretty good because that was actually my diagnosis. So well done. So second diagnosis is viral pharyngitis, which, as I said before, is a possibility. Sometimes you may not get necessarily a bacterial infection. It could be a virus, in which case antibiotics don't help that much. And pharyngitis is an infection of the throat. So it's doing the right location in terms of the anatomy, in terms of where the infection could be. And the third one is saying that it could be a streptococcus pyogenes infection, which essentially means strep throat, which again is a throat infection. So all of these three diagnoses are really quite plausible. And I suppose at the end of the day, it becomes up to the doctor to work out what exactly is wrong with that patient. But moreover than that, the application also gives you recommendations for myself to further find out what could be going on with the patient to help with the diagnosis. So it's actually said to me that I should recommend to ask the patient about the medical history, inquire if they've had similar throat issues in the past. It's also asked me to describe the symptoms more specifically and to provide a detailed description, including how long and what times you've been experiencing feverishness, which are all really plausible questions, actually. And to be honest with you, if this wasn't me just simulating the conversation with myself, I probably would ask all of these questions if I'm seeing the patient. It's just a bit harder when you're talking to yourself. So that's pretty clever. So let's just say, for example, I've forgotten what tonsillitis is. I can actually click on this diagnosis over here, and it will actually come up with a bit of a database to tell me what tonsillitis is, and it'll tell me why it's chosen that particular diagnosis for this scenario itself. So let's take a look and see what it says. Alrighty. So it's saying, to understand your diagnosis of suspected tonsillitis based on enlarged tonsils and white spots in the throat, let's review what we know about this condition. Alrighty, so it said to me that the symptoms you've described are sore throat, it hurts when you're swallowing, there's no other symptoms, etc. So it's kind of understood and extracted that information from my consultation with my patient, and it said that the most common cause, as you mentioned yourself from past experience, are bacterial or viral infections that inflame this area, and it can cause discomfort when swallowing. The white spots on the back of the throat could be a fungal infection, but without any other symptoms, it could be just a bacterial or a viral infection as well. So yes, fungal infections are possible, but I'd say in this situation, you have to put two and two together, and you know that person's got fever, they can't swallow very well, and the tonsils are enlarged when you're examining them. You're most likely going to say it's a bacterial infection or a tonsillitis. So very clever to tell me what it is. And of course, it does mean that you still rely on the doctor to put two and two together to make the actual diagnosis. So there we have it. So now it's saying that treatment depends on the cause. Antibiotics could be useful, and so on and so forth. So that's pretty cool. Now, if I wanted to consider what it could be a viral pharyngitis or a streptococcus or a strep throat, for example, I can also do the same thing, have a read of it and see what it has to offer. Okay, so I've got to say I'm pretty impressed with that so far. It did do quite well. So I'll say Doctor 1, diagnosis pad 1, ding, 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 next round. Okay, we're going to do the next case now. This case is probably one that I see too many times, and I often see it in patients. I probably see it like at least once a week, and often it's typically a female patient, perhaps, maybe in their 20s or 30s, and usually they come in with this same presentation of, I feel tired all the time. Now, that's what I'm going to present to this AI, and I really want to get down to the diagnosis that I'm aiming for. Now, I'm going to put a little caveat to this because it's actually quite a hard diagnosis to make. As a doctor, we often present with people who are tired all the time, and there could be a plethora of different reasons as to why they could be tired. And it's a doctor's duty to work out what exactly is causing that. It could be something as simple as, they're just not sleeping very well. Perhaps they might be pregnant or they're breastfeeding that can cause tiredness. It might be a little bit more than that. It could be that they've got metabolic disorder. For example, they might have thyroid issues. They might have diabetes. Or it could be that they've got a vitamin deficiency, for example, an iron deficiency, or even like a B12 deficiency. So as you can see, there's a whole bunch of different causes for feeling tired all the time. And naturally, as a doctor, you're going to have to work out what exactly is going on. And it might be that you might want to do a blood test, you might do some examinations, and only after you've received the results of those extra pieces of examination that you'll be able to make that diagnosis. So let's see how this AI fares. I think I'm going to say that I've got tiredness all the time related to an iron deficiency, because that is really common as a female who might be menstruating, might have a heavy menstruation. So let's just see how we go. So we're going to start with a new session. This is going to be tough. So let's just see if we can really get something out of this. And we'll keep it as vague as possible, but the same as what I would normally get with my patients. Hello. Oh, hello, doctor. Doctor, the problem is I've come to see you today because I feel so exhausted and I just feel tired all the time. And I just can't shake it off despite sleeping really well. I just can't seem to feel energetic anymore. I don't know what's going on. Oh, I see. So you said that you've been feeling tired all the time, and it sounds like a new thing because you said that you were energetic before. Yes, yeah, it's been going on, ever since I had Chloe, my daughter. She's 8 months old now. I feel like I haven't been able to get my energy levels back, and I'm so exhausted. I'm so tired, and it could just be that I'm not sleeping very well, but it doesn't feel like that because she's sleeping really well now. She sleeps through the night, so it couldn't be that, could it? Well, it's interesting that you say that, Sarah, because sometimes you can feel tired because you're not sleeping too well. But I'd like to go into a bit more detail of what's been happening in your life, if that's okay. Oh, yes, of course. So I know that you had Chloe 8 months ago now, but tell me, have your periods returned? Well, yeah, they did. They returned about 2 months ago now. I was really unlucky, actually. They returned 2 months ago. And yeah, come to think of it, they're not very pleasant. Oh, in what way are they not very pleasant? Oh, they're so heavy, doctor. I literally bleed for 3 or 4 days and I'm so drained by the end of it. I could literally have a cat nap in the middle of the day. I'm sorry to hear that, Sarah. And what about anything else? Are you eating okay? Well, yeah, I'm eating fine, but you know what it's like with a newborn and, you're always rushing around them. I just don't get time for myself. It's really tough. And are you breastfeeding, Chloe? I tried to breastfeed her. I did breastfeed her actually for about 3 or 4 months and then I stopped because my milk supply dried up. So I've stopped now. Now I'm on formula, which is probably why my period has come back, I suppose. Okay, let's stop there. Okay, so I've given it some nuggets of information and, as a doctor, if I was listening to this patient, I would immediately think, has this person got an iron deficiency because they were lactating? Because, obviously when you are breastfeeding your babies, you can lose a lot of minerals and vitamins from that. And secondly, she also told me that her periods have come back and they're really heavy, which wasn't new, which is old for her. So that's another way that she's losing iron. And she's telling me that she is able to sleep well because her baby's now sleeping through the night. So that kind of indicates that perhaps it's not so much a metabolic issue, although I haven't actually asked those questions just yet. And that might be something that the AI might tell me to ask. But it could be more that there's a deficiency of some description relating to the breastfeeding, relating to the periods returning, and relating to maybe the diet not being so good as well. So it's come up with some diagnoses. Let's take a little look and see what it said. So, this is interesting. Number one, it said anemia, which is literally an iron deficiency. So it's saying anemia, likely iron deficiency anemia due to heavy menstrual bleeding. Very clever. Secondly, it's saying I could be depressed. Now, that is actually a really good thought because postpartum depression is actually commoner than you think. And aside from having the metabolic issues and aside from having vitamin problems and whatnot and everything else I said, mental health also plays a huge part in patients who come in feeling tired all the time. And in fact, as doctors, if we do X, Y, and Z examinations and investigations, and we don't come up with anything, then often we think, is there something else going on? Is it that they've got a new baby, they're feeling upset, or is it that work is causing them stress? So that, I've got to say, I actually kind of didn't think of that. And you know what? It has helped me in that respect. So well done to the AI. I've got to give it one for that. But that certainly is a very, very plausible diagnosis that you have to think of when you are listening to a patient with this sort of diagnosis. And now it's also said, thirdly, a hormonal imbalance. So it's actually alluding to whether or not there's a metabolic issue. So given that I've only given it perhaps a 1 or 2 minute presentation, it's sort of come up with 3 cardinal diagnoses or possible diagnoses that are all very respectable. It's not hallucinating at the moment, so that's pretty cool. And it's given me some pointers in directions of where I should be going. So let's take a look at its recommendations. So it's asked me to, or it's recommending me to tell the patient or ask the patient, have you noticed any changes in appetite, any weight loss or weight gain recently? Now that's important for metabolic changes, for example, for diabetes or for thyroid issues. So it's trying to allude to the hormonal imbalances. It's also recommending to ask as well, are there any times where it feels like something is stuck in your throat? That could indicate an underactive thyroid. Again, it's going for the hormonal imbalances, which is very clever. And thirdly, do these feelings of exhaustion and tiredness also affect other parts of daily life, such as work, school activities? So that's kind of getting an idea of the kind of psychosocial situation. Is it related to depression? Is it that this person is just doing too much? What is going on there? I like this. I've got to say, I'm quite impressed with this so far. So let's just say now I've forgotten what an iron deficiency anemia is, or I don't quite understand why this has come up with this. So let's have a click on that and just see what it's telling me. So this is useful in a situation, for example, where I'm like, you know what? I didn't even think of an iron deficiency. Why is it prompting me to say iron deficiency? So it's come up with this medical terminology database, and it's going to tell me why it thinks or why it's suggesting an iron deficiency. So it's saying that heavy or prolonged menstruation can lead to blood loss that results in insufficient levels of red blood cells and hemoglobin, the components responsible for oxygen transportation within our body. And this deficiency may cause fatigue as your muscles are not receiving enough energy and so on. So what else is it saying? It's saying that blood loss can be a problem. Nutrition deficiency. So it's mentioning that because she mentioned that she's not eating very well, that could be a reason why she might be iron deficient as well. Breastfeeding may also contribute to anemia. So the clever thing about this AI is actually listening to my conversation, and it's taking those salient points that I mentioned, the diet not being good, the menstruation being an issue, the breastfeeding. And it's kind of taking all of those things and it's analysing it and saying, you know what, I think it could be this because you've mentioned X, Y, and Z. And I've got to say, I'm quite impressed with that. That is quite clever. It's kind of like having a friend, you know, it's kind of like having a companion working with you and saying to you, it could be this, think about this. It's very useful. So in summary, it's giving me a summary, and it's giving me things that I can do to improve, or the patient can do to improve, eating different foods and so on. I suppose that if I was to, you know, in real life, most likely, I probably wouldn't make a diagnosis of an iron deficiency anemia without doing a further investigation, unless I was completely certain of it. But 99% of the time, you usually follow up with a blood test. So that would be something that I would probably recommend for my patient. Now, I mentioned before about postpartum depression. I just want to click on it and see why this AI picked up on the postpartum depression, because I wasn't alluding to it, but I'd be intrigued to find out why it thinks that. So it's saying that postpartum depression is a serious mental health condition, absolutely is, and that can develop after giving birth. So it's remembered that this lady, Sarah, has just had a baby 8 months ago, so it remembers that she's postpartum, and it could be a possible diagnosis. So key characteristics of this disorder include persistent feelings or episodes of sadness, hopelessness, along with mood disturbances, irritability, anxiety, anger, outbursts, etc. And they're often accompanied by physical symptoms or signs like fatigue, as you described. There we go. So it's saying that I've listened to you, I've heard that you're postpartum, you've given birth to a baby and you're feeling tired. Could this also be postpartum depression? So something just to consider as a clinician. It's pretty cool. So now it's telling me as well, you know, how you treat it, what kind of medications can be treated, and it's giving me a little conclusion there as well. So I like that. Let's click onto hormonal imbalance as well, just as intrigued to find out why it thought that it could be a hormonal imbalance. Now, of course, we did mention before that it can also be a hormonal imbalance, but I'll be intrigued to find out why this guy thinks it could be that as well. So it's saying you've been feeling consistently tired for several weeks despite getting enough sleep. It even mentioned Chloe's name. It's mentioned Chloe's name, which is her daughter. Periods have returned, insufficient. So it's saying, what is it saying here? It says the hormonal changes associated with breastfeeding, cessation, and the return of menstruation may be affecting how your body is functioning overall. Your heavy menstrual bleeding may also contribute directly to fatigue. Formula feeding instead of breast milk could have contributed. Well, that's interesting, because actually when you do change from breastfeeding to formula, your hormones do change naturally. You don't release something called prolactin. It really goes down. So prolactin goes really high. It's a hormone that's in your brain. It's responsible for lactation and period control as well, amongst other things too. But once you stop breastfeeding, the prolactin goes down. And so that is a hormonal change. So it's alluding that, you know, hormones are changing. It's listened to the conversation that breastfeeding has stopped and the hormones are changing, which is very clever. Alrighty, so I'm quite impressed with that. So I'm going to say Dr. 2, diagnosis pad 2. All right, I'm going to try and trick you up now. I really want to trip this up. So if any of you guys watched my ChatGPT video, we did a scenario where I was a drug seeker. Now, unfortunately, more common than not, I do see some drug seekers in clinical practice, and they present with what we call passport symptoms, meaning that they come in for something, but they want to go on to something else. And they've rehearsed this conversation 1,000,001 times, because very often what happens, sadly, in Australia particularly, is that they go from one doctor to another and they try to get medications, which are usually really quite controlled medications, such as, you know, opiates. And they have a spiel and they say this spiel and they hope that they might come across a doctor who might be a bit naive and they prescribe the medications. Now, ChatGPT did a really poor performance on this. And essentially what happened is I presented with back pain, wanting some of these medicines, and it basically said, yeah, sure, have these medicines. So I'm going to see if this will actually, this is the hardest case I think I'm going to present to it. I'm going to see if it gets the salient points of me being a drug seeker and what it suggests. Are you guys ready? I'm ready. Let's get going. Hello, Chris. How can I help today? Oh, hi, Doc. Yeah, look, I'm just visiting in town for a couple of days, and look, it's just my back, doc. It's been killing me. It really hurts. Oh, I'm so sorry to hear that, Chris. How long's it been hurting you for? Oh, doc, look, it's been years, ever since I had that car accident. You know, it's just been going on and on and on. Look, don't worry about it. My doc has done everything. I forgot my pain meds, and yeah, that hotel bed I'm sleeping in is just so uncomfortable. Oh, I'm so sorry to hear that. Could you tell me a little bit more about your back? Whereabouts is it hurting you? Oh, look, doc, it's just in my lower back. It hurts. You know, it hurts so much. But honestly, doc, there's nothing you can do about it. Like, my doc has done everything for me. Oh, when you say he's done everything for you, what sort of things has he done so far? Oh, he put me through that tunnel thing that makes loads of noise and the scanner or whatever he said. I don't remember, doc. You know, it's been so long now. Oh, I'm sorry to hear that. And did anything come of those results? Yeah. He said I got some sort of disc problem or this, that. I can't remember the terminology, doc. Or, you know what, doc? I'm gonna save your time. I just need my medicines because I'm only here for a couple of days in town, and that hotel bed. Oh, doc, I tell you, it's so uncomfortable. Oh, sure. But before we get on to that, is it okay if I just ask you a few more questions about your back? Yeah, sure. I guess so. So you mentioned that you've got a disc problem. Has your doctor tried anything else other than the medication? Oh, yeah. Like, you mean physiotherapy? Yeah, that sort of thing. Yeah. He tried that. And honestly, doc, it just didn't work. I'm still in so much pain. So yeah, I'm still in so much pain from it. Okay. And you mentioned a few times about your medication. What medicines are you taking at the moment? Oh yeah, doc, I'm just on these, like, I forgot their name now. Is it codeine and oxycodone? I think it is. Yeah. I think it's, look, doc, I'm just in town for a couple of days and I'll be out of your hair. Just give me that prescription and I'll be out of your hair. Sure, okay. And how often do you take those medications? Oh, just when I don't take them all the time, doc. Don't get me wrong, I'm not addicted or anything like that, but I just need a couple, you know. I don't take them all the time. It's just sometimes. Okay. Right, I'm going to pause that because that is really common presentation for patients, and often they will, say they've got symptoms, and I don't doubt that they do have symptoms. I'm sure they're in lots of pain, but often they just try to trivialize what they want, and they just say, look, I just need a couple of medicines, I just need a couple of tablets, just see me through a few days. And the great thing about working as a family doctor here in this state certainly is that we have an ability to look at patients' real-time prescriptions. So that means we're able to log in online and look at their name and so on, and just have a look and see what kind of prescriptions they've been prescribed in the past and how often they've been prescribed it as well. So patients may not know this, but things have changed, regulations have changed. And before, in the past, when I first moved here to this country, we didn't have this real-time situation, but now we do. And it's become a lot easier to see if somebody is prescription shopping or if they're going around getting these lots of prescriptions. And the best thing to do with these patients is just pause for a minute and then just check on the real-time database. And you'll find that they've been prescribed these controlled drugs multiple times throughout the week or even through the day sometimes. And usually they are very big quantities as well. And in those situations, we politely decline those patients and we refer them on to further help to help to reduce their addiction. These situations are difficult in general practice, and sometimes patients can get quite aggressive. And I had a couple of situations where they have been aggressive and I've had to open the door and just kindly show them out. But nothing too serious, but they can escalate really quickly. Let's take a look. All right, let's see what diagnosis bad has to offer. So number one, it says the diagnosis is a disc problem or low back pain with potential underlying cause. That is completely fair. I mean, the patient did tell me that they had a disc problem. They said that there was some issue with their back and they definitely got some back problems. So yes, I'm going to give that a tick. Very good. Number two, it says that it's got failed previous treatments such as physiotherapy and medication management. Yes. That is also a very reasonable diagnosis. This patient clearly has said that they've tried everything. They've been through the tubey thing, the MRI scanner or the CT scanner. They've had physiotherapy and that has not helped. So the third one is opiate dependence based on the mentioned codeine oxycodone prescription frequency despite not being addicted, according to Chris's statement. So it's remembered his name. So I'm glad that it's actually come up with a diagnosis of opiate dependency because ChatGPT didn't quite get that. So that's awesome. So if, for example, I was a new doctor and I wasn't aware of the situation of dependency of these kind of medications, having this to tell me that, hey, you know what, just watch out, this guy might be addicted, is actually quite useful because this often happens to new doctors or doctors who are new to the area and they don't quite click on that patients say certain things that It might sound innocent, like this guy could have presented really innocently. He's doing me a favor. He's saying, look, I just need a quick prescription. I'll be out of your hair and you can get back to seeing the rest of your patients. He's being really helpful. He could be very innocent. But if you don't kind of have the experience of seeing these sorts of patients, you might completely miss that he has got an opiate dependency. So that's awesome. I'm glad that it came up with that. I'm going to click on it and see, why did it say that? Because, you know, at the end of the day, it didn't have to say that. So let's see what's happening. All right, so it's saying that he's been suffering from lower back pain for years since a car accident, so it's remembered that. Doctors tried various treatments and now we're on codeine and oxycodone. You've mentioned forgetting some details from previous consultations, but you're currently on a combination of medication. Your doctor is concerned because despite multiple treatment options not working for you, the frequency of these pain medications raises questions about potential dependence or misuse. There we have it. That's awesome. So I'm pleased about that. I've got to say that is good. I'm glad, because if, like I said, if I was a new doctor, I didn't quite catch on this person was addicted, I might just prescribe them and I might be fueling their addiction as well. So that's good. That kind of made me stop in my tracks and think, okay, is this person addicted? Yes, possibly. So I've got to say, whilst Diagnosis Pad is a great symptom checker, given that it has a great medical terminology database that is actually contextually aware according to your conversation, probably best used as an assistant to the doctor. Because as we saw in those examples, the doctor can put 2 and 2 together and it can kind of fill in the gaps that perhaps the AI hasn't been able to fill in. For example, the doctor can still examine the patient, they can have a look at the real-time prescriptions, but they can use this as a guide to see, oh, okay, you know what? I need to do this or I need to do that. And I don't know if you guys know this, but doctors are often expected to know everything, especially family doctors are expected to know everything. And often there can be gaps in knowledge, or there may be situations where we need a bit of a refresher or a revision. And certainly an application like this, as we've demonstrated today with postpartum depression, or even just checking out the frequency of the patient's prescription, it can really help to give that doctor a little bit of a nudge in the right direction to say, hey, you know, make sure you check this and make sure you check that. So I've got to say, this is actually really quite impressive to use as an assistant for the doctor. Do I think that AI will replace doctors? Well, maybe not today, but I certainly do think that something like this will help the doctor to help you as the patient to get a better patient outcome. And as we saw as well, it does also provide the doctor with some notes, meaning that they can just upload those notes onto the computer record rather than arduously typing and typing and typing. And the problem with that is that if any of you have ever noticed your doctors, you know, if the doctor's spending time typing, they're not looking at you and they're not being engaged. So if this application is able to provide the doctor with notes so they can simply upload onto the patient's file, that means that more time can be spent focusing on the patient, better eye contact. And, you know, as a patient, sometimes myself, I feel so much more listened to when a doctor is looking at me eye to eye and maintain that good eye contact. So there you have it. That's a wrap up of Diagnosis Pad. It works in real time and offline, completely on the device, which is very smart. So helping to reduce those privacy concerns that we spoke about. But not only that, it also helps to provide the doctor with potential list of diagnoses and some recommended questions that they can ask as well. But what do you guys think? Do you think that artificial intelligence will replace your family doctor? Let me know in the comment section below and I'll see you on the next one. Take care and stay healthy.